If you're a doctor, midwife, a sonographer, a nurse, anyone who works with pregnant patients or people who've experienced pregnancy loss, this video is for you. I'm not here to attack you. I know you're doing your best under impossible pressure, but I need you to hear something that your training probably didn't cover. The words you choose in a consultation room have a ripple effect that lasts years, sometimes decades, and a few small changes could make an enormous difference to the people sitting across from you. I'm Bianca. I'm an empowerment coach, author, and I've spent 13 years in the pregnancy loss space, both as a lost mom who experienced 6 losses across 8 pregnancies, and as someone who's walked alongside hundreds of women through theirs. This channel is where I talk about grief, healing, and rebuilding your life after loss. If that's why you're here, please subscribe. It helps more people find these conversations. Although this video is specifically for medical professionals, I want to invite the lost moms to stay. This is about you. These are the things that you've experienced. And if something in this video resonates, I would love for you to share it with your care providers. Before I get into the specific phrases, I want to name something bigger, because I think it's the root of what goes wrong. In our society, there's this idea that pregnant people are cute. They're sort of public property. They are in the range of puppies and kittens, and we get to touch people without their consent. They have all these things going on that they can't really think about big things. Don't worry, your pretty little head was something I heard, and it might sound a bit extreme, but the attitude isn't that uncommon in the pregnancy space. But when something goes wrong, those same people who moments ago were considered cute and needed to focus on just growing their baby, those are the people who are needing to make big decisions on the spot, work through a multitude of emotions without being given any space to process. And that shift is brutal. That shift can be incredibly difficult. So let's talk about the language, because it starts there. When someone is pregnant, most medical professionals even will talk about the baby. How's the baby? How are you? Everything is about the baby. Congratulations. You must be so excited about the baby. And the moment something changes, the moment something goes wrong, that language changes entirely. Suddenly we're talking about the fetus or products of conception. It becomes clinical and detached. And that's really, really difficult for the person who is still carrying her baby, sometimes carrying her dead baby inside her. And to suddenly have your baby change to these clinical terms, it feels like that baby has just been erased from the conversation at the exact moment that that person needs to feel seen and acknowledged. So my ask to the medical professionals is mirror the language that your patient uses. If your patient says baby, you say baby. That one shift costs you nothing, and it means everything to the person on the other side. Let me walk you through some of the phrases that I've heard and that I hear repeatedly from the women in my community of 13 years. This happens in 1 in 4 pregnancies. Sure, that's the fact. It's a statistic, it's out there. And if you've had more than one loss, you're very much aware of the statistic. But it utterly minimizes the experience of the person who is hearing that phrase. It minimizes the loss that that person is experiencing. And it minimizes everything that they have lost from the moment they saw those 2 little lines or that positive test and the life that they dreamed. That is all suddenly gone. So yes, miscarriages happen in 1 in 4 pregnancies. That is a statistic that everybody knows. But it minimizes the experience of that one person. Remember, that is a whole person, and that might be their first or only pregnancy. And to minimize their loss with, you're just a statistic, is devastating. The next one I heard a few times from a few different professionals was just try again after 1, 2, 3 cycles. No explanation, no context, no acknowledgement of what I had just lost. It gave my grief an expiry date, and it minimized the fact that I had experienced this huge thing. I think the biggest thing as well was no one ever told me, why am I waiting 1 cycle or 2 cycles or 3 cycles? What is the recommendation behind that? Not everybody wants to know the exact why, but providing that information just saves someone going to Google and all of the things that doctors hate, with parents coming with statistics that say, oh, the internet says. If you provide the explanation, we're far less likely to go and Google it ourselves. Another one, which is a major thing, which is never really explained very well, is if the bleeding is worse than a period, please go to a doctor or hospital. All periods are different. Every single person experiences periods differently. I might handle them completely differently to someone else. A miscarriage is nothing like a period. Certainly for me, it was precipitous. It was incredibly painful. It was over very quickly. But no one had really said to me very specifically, what if the bleeding is worse than a period? So is it going through 2 pads in an evening, or is it going through 2 pads in an hour? Be specific, because different people experience periods differently. Therefore, a miscarriage is going to look and feel different. And someone who is hemorrhaging, who has particularly heavy periods, may not realize that they're hemorrhaging. Be specific. Be clear. Let someone know what other symptoms to look out for. Be specific. I cannot repeat that enough, because it was one of the most triggering things for me. Don't worry your pretty little head, or any version of that. I saw a doctor when I was pregnant with my daughter. It was my 7th pregnancy, and I had 1 living child. I'd had to change obstetricians, and I arrived for my appointment and had everything looked at. He had seen my history, and after he had confirmed that I was pregnant, we sat and discussed the results. I shared my fears, and he literally said to me, "Don't worry your pretty little head off. Just stay positive." And then he addressed everything else in the meeting to my husband, which also was flabbergasting to me. But I had genuine fears. I was a human who had been through the ringer on this fertility journey. And my humanity and my intelligence was questioned in that moment. And it was very frustrating for me. Condescension dressed up as reassurance is still dismissal. And finally, one of the phrases that is one of the hardest, particularly in the TFMR, termination for medical reasons arena, is incompatible with life. I understand the phrase. I understand that it is important that the medical professionals communicate that a pregnancy or a child is incompatible with life, whether they'll make it to delivery or not. But the hardest thing is the number of times that it was said to me. Every single person who used that phrase used it multiple times in my consultation. You only need to say it once. I promise we heard you. Once is enough. Try and soften the description or the wording as you go. Every single time I heard that word, it was the knife twisting in my heart. It was ice running through my veins. It was a devastating diagnosis that I was dealing with. And I was having to deal with doctors using words that were making it feel harder and harder. And then there's the exhaustion of having to repeat yourself over and over again. Every new doctor, the receptionist staff, the pathology staff, the sonographer, the insurance broker, every single retelling of a pregnancy loss story is re-traumatizing. And having to repeat it over and over, particularly to a doctor or a medical professional that you've already spoken to about it, is devastating. It's the hardest thing. It is so minimizing, and it takes the value of my story away. This is just a gentle reminder that you are not just gathering information. You're making a person relive the worst moments of their life in a clinical setting where they don't have a choice as to how much information they give or don't. So my ask, please, is write it down, brief your team. Don't make a patient who has already lost a pregnancy tell that story to every person in the room every time they come to you. Have a note, have a sticker system so that if there's a new receptionist, She's not asking questions that are inappropriate, which happened to me a couple of times. Just find a system that takes minimal effort to make sure that everyone in the room is aware that someone is dealing with more than just being pregnant. And I want to share something that happened to me personally because I think it speaks to the deeper issue. After my diagnosis with my final pregnancy, where I had seen a larger than expected nuchal fold reading in the ultrasound, I was sent to a maternal fetal medicine specialist, Dr. B. I had already seen a doctor that day. I'd already heard Incompatible with Life a number of times. I then went into this meeting. Once again, he used the term incompatible with life multiple times. Through all of this, he very strongly recommended terminating the pregnancy and took a lot of time describing mirror syndrome to my husband, how the diagnosis that we'd been given could put me at risk and my life at risk, and had really talked a lot of fear into us. Also, in this 20-minute consultation, had asked me to make decisions about what testing we wanted, when we were going to do it, how long we were going to wait, all of these sorts of things. We'd made the decision to do the CBS test then and there because we were at the right time window. Otherwise, we'd have to wait another 3 to 4 weeks before we could have an amniocentesis. And I was crying. It had been a devastating 3 days. I'd had the initial diagnosis on Friday. This was now Monday afternoon. I'd been to the obstetrician Monday morning. It had just been a very long, very stressful day with a lot of emotions. I was pregnant, hormonal. I had children at home. It was a very, very stressful day and a very stressful situation, and I was crying. I was having a little moment with my husband while he was getting ready for the test, and the tears were rolling. And he turned around to me and said, if you're going to be emotional, I can't do the test because you have to keep still for me to put this huge needle into your belly. And I remember the look on my husband's face as he saw the first thought through my mind, which was me trying to jump off that table and wring that man's neck. And through gritted teeth, I said, my being emotional has nothing to do with my ability to keep still. I remember when we left that appointment and just sort of looking at my husband and going, I can't believe someone who works with pregnant patients would call me out for being emotional. Just blew my mind. So if you work with pregnant patients, you will encounter emotional women. We are pumped full of hormones which are specifically designed to increase our emotional capacity. We are experiencing the most crazy time in our lives with all sorts of things physically, emotionally, hormonally happening inside of us. And we are often getting bad news. We're going to cry. We're going to experience fear and grief and anger. There are going to be loads of emotions in your rooms. That is not a problem. That is a human being having a human response. As a medical professional, if that makes you uncomfortable, please get support for that discomfort. Because the alternative is that your patients leave your rooms feeling that their grief was an inconvenience. It is not your patient's responsibility to manage your discomfort with their emotions. I'm not just here to tell you what not to do. Here's what actually makes a difference. Explain the why. This is so important because whether it's about testing or a recommendation that you're making or a suggested supplement, give a brief explanation of why that's your recommendation. It saves so much worry on the part of the pregnant person. When something does go wrong, acknowledge the person, not just the diagnosis. We left so many appointments with no pictures of our baby, whether it was that last pregnancy where everything went wrong in just about every appointment we had. We left without photographs. This is just a reminder that we're humans sitting on the other side of that diagnosis and on the other side of this case number. And just acknowledging the fact that we are there and we are human and we are going through a very hard time can make a huge difference. And then give real and practical information, particularly when it comes to symptoms or medication or procedures that are about to happen. Because honestly, the middle of the night is a terrible time to be frightened and alone and not know if what's happening is normal, especially if you haven't been told to expect what is happening to you. And when you have a patient who has had multiple losses, please treat the test and conversation with the weight it deserves. Being told to wait for 3 miscarriages before investigating further is a policy that causes real, lasting harm. If you'd like to share this video with a colleague or a practice manager or anyone who works with pregnant patients, please do. This conversation needs to travel further than my corner of the internet. I've spent 13 years in the space as a lost mom, as a support community founder, and as an empowerment coach. I've written a book about it, and I believe deeply that with the right conversations, medical professionals and lost parents can have better experiences together. If this video resonated with you, please like it and subscribe. It's the best way to help these conversations reach the people who need them. If you'd like to bring this conversation into your practice, your team training, or your professional development program, the link to reach me is in the description below. And if you've experienced pregnancy loss and you're watching this, I see you. What you've experienced in those rooms is real and it matters. There's a link to my newsletter in the description. It's where I show up every week for those navigating all of this. I'd love to hear from you. If you've experienced any of this, share the phrases that stuck with you in the comments. And if you're a medical professional watching this, I'd love to know, what do you wish your training had covered? This conversation goes both ways, and it's one worth having.